What's good? This is Dr. Mario Wallace with all things strategic and the ATS Academy and Neuro Gladiators. Today, I want to cover a three-part lecture series, beginning with the ADEM model, that is ADEM model, the strategy map, and human capital readiness. I am using a PowerPoint to guide the discussion, but before we get into the PowerPoint presentation, I would like to give you some backdrop on myself as well as the ADEM model. So years ago, I took a course on the balance scorecard from the Palladium group, in which I went through a 5-day certification program and completed a 2-hour examination testing my knowledge of and practicality of the balance scorecard. The balance scorecard is a strategy management methodology that's authored by Doctors Kaplan and Norton from the Harvard Business Institute or Harvard Business School. This concept is one of the most successful strategy management tools that came out of Harvard in over 30 years, according to the Harvard Business Review. In 2017 and 18, I was one of the few, or maybe the only person at this academic medical center in Arkansas who had knowledge and skill and practicality of the balanced scorecard. So I led the institution in a strategic planning activity in which I developed a strategic plan for the organization, as well as for over 35 business units across the organization. While working at this institution, I initially worked in organizational development, where I was managing a leadership institute, in which I facilitated strategy management training to over 200 leaders. So this is director level leader and executive leadership in the organization. And what I found out was that they were great at developing strategy, thus analyzing the market, as well as developing the actual goals, objective, and strategic initiatives for the strategic plan. But they were not skilled at executing and managing the strategic plan. With this said, I began to look at themes, given that I was a researcher and understood qualitative research specifically. I began to interview these leaders to understand which part of the strategy management process that caused them challenges. And what I noticed was 95% of the people who I interviewed said that the execution phase of strategy management or the implementation phase of strategy management caused them the most problems. Thus, according to a research study and a survey taken, 20% of strategic initiatives in organizations are ever fully executed out of 100%. And less than 80% of the people in organizations are aware of the strategic plan. Thus, after the interview, I began to code and look for things within the interview transcripts. And what I derived at were 4 things. 1 was analyze, 2 was develop, 3 was execute, and 4 was manage. And thus, the ADEM Strategy Management Model was created or was developed. I am the author of the ADEM Strategy Management Model and methodology, and I've led some of the largest organizations through a strategy management process using this methodology. It's effective in its application, and I also have research publications to validate my discussion on the ADEM Strategy Management Model. So with that said, let me talk more about this actual model. So After conducting research, I decided to write a book that explained the process of my findings to leaders at this specific institution, and never thought about taking it further than that. But as I left the institution, I noticed that there was an opportunity to share this knowledge with people across the academic healthcare setting, as well as health, hospitals, community health, and higher ed, so they can actually understand what it takes to fully execute on a strategic plan. And one of the reasons why I chose I landed on the acronym uh, is because one part is it's the birth or the beginning of the knowledge of how to effectively analyze, develop, execute, and manage on a strategic plan. Thus, I use the term ADEM, which is synonymous to Adam, as within the Adam and Eve. What I find is that most leaders at a glance like to understand what's taking place in the strategy management process. Given that there are so many drivers, um, I had to land on a unique acronym where if there is a question asked in an organization by anyone who facilitating the ADEM model within an organization, they can um, share with the leaders exactly where they are in the process. So the ADEM strategy management model or method has 4 phases. The first 2 phases are pre-retreat and retreat, meaning the elements of strategy come from the analysis of the market, executive interviews, both internal and external, and those are partners or organizations in which you're collaborating with. Internal interviews, that's consist of the executive level leadership, as well as focus group, which is consist of director level leaders in town hall, and that grabs the rest of the organization. That information must be presented to leaders prior to the retreat to get feedback from the leaders to make adjustments leading into the retreat. Then we have the development phase, which is strategic vision, consists of the items or the drivers: strategic vision, change agenda, objective, strategy map, measures and targets, initiatives, and the balance scorecard. Earlier, I mentioned the balance scorecard in my education and knowledge of this methodology. Basically, what I've done based on the interviews of leaders within a specific organization, in which I derived at the themes, which became phases within this methodology, I basically grouped the elements of the balance scorecard within these phases as it relates to the drivers, given that based on my experience, this is one of the most successful methodologies today. But because the literature on the balance scorecard consists of over 10 books that's written in academia or academic language with over 300 or 400 pages, not a lot of people will get through those books to fully understand the methodology. But within my 100-page book, you can grasp the elements of the balance scorecard and see how I group together all of the elements of the balance scorecard in the development of the ADEM model, which makes it easy to understand, to be able to see the sequence of events, of activities, as well as the application of it. So then we have post-retreat, that's execute, and then we have manage. So basically, after the retreat, leaders in organizations still need to gather to look at the actual strategy that was developed at the retreat, determine the risk associated with the strategy, align the strategy within the organization, cascade it across the organization, create an effective communication plan, a change management strategy to mitigate resistance, and sometimes create personal scorecards so everybody, even the frontline staff, can be tied to the actual strategy. Lastly, manage. Create a governance calendar, initiative review, where you're reviewing the initiative at least once a month, strategy review, where you are reviewing all of the strategic plan within within the organization at least once a quarter, and strategy refresh, where you're looking at the strategy at the end of the year against how the market has shifted, and you pressure test the strategy against the market and make edits accordingly. So let me go a little more in detail. So, analyze phase. Market analyses. Today we have things like ChatGPT, Gemini. We have other resources where we can actually conduct effective market analyses or get a draft of what it looks like in this particular region or state or city, depending on what we're looking for. And then go to the various places like the healthcare department and things like that. If it's for healthcare, go to US News Today, a US magazine today. If it's for higher education or things like that, to determine what areas of focus for that specific industry. Once you gain that information, you put it into some type of high-level document, share it with executive leaders, and they share it with their partners or external leaders who support the organization, including the board. They read through this market analysis and determine the things that, according to an interview, determine the areas of focus for their organization, maybe 3 to 4 high-level focuses. And now we have to figure out what the resources are to align to the focus. Then we do focus groups. You allow the mid-level leaders to see the goals that the executive landed on and allow them to give feedback as it relates to the strategic initiatives and metrics, because they're the one who are leading people to do the work. Town hall, and those are mainly in focus groups. Then you have town halls where the entire organization get a chance to see the strategy, see the goals that the leaders and mid-level leaders have landed on, to give feedback before going to the retreat. This helps to mitigate resistance going forward if you allow them to feel a part of the process. Then we go to development. You use the information that's identified in executive interviews, market analysis, focus group, town halls to create a two-sentence strategic vision that has a strategic destination, a date in which the vision ends, and use that strategic vision to create what we call a change agenda, looking at the resource with the organization and determining what things need to change in order to meet the strategic vision. Once we do that, you will see the gaps. You identify strategic objectives. You populate them into a strategy map in a cause and effect manner. You create measures, target, and strategic initiatives, and then you build out the balanced scorecard. You take that from the strategic retreat and you determine the risk within the strategy and how to mitigate risk. You may create several strategic initiatives based on what the risk is to ensure that if this plan A doesn't work, plan B, we have a plan B. Then you align the organization and resources to the strategic plan. In execution, you cascade the strategic objective down to the business unit where they fit. Then you create a communication strategy, how you plan to communicate out quarterly, monthly, weekly, whatever that looks like. And you create a change strategy to address the resistance that's being identified as you begin to execute the strategic plan. As you get ready to manage, make sure you have a governance calendar where everything is populated in, so everybody knows when these events take place, as it relates to the strategy review meeting, the strategy refresh meeting, and the strategic review meeting, and how the strategy will be communicated, the results of the strategy, how people will stay in touch with the strategy. And that's including the media, the community, and so forth. Then you have these initial review meetings, strategy review meetings, and you have the strategy refresh meetings. Again, I am Dr. Mario Wallace. Hopefully this information was helpful. If you have any questions, you can reach me at allthingsstrategic.org or info@allthingsstrategic.org if you want to email me. I am located on Facebook, Instagram, LinkedIn, and TikTok. Peace.